I would like to talk about climate change or the impact or the consequences of climate change on the insecurity. Number one, I would like to talk about Lake Chad. Lake Chad is a river that passes through almost 6 countries, from Central Africa to Cameroon, Nigeria, Niger, and I want to world to know or understand that Lake Chad is a source of livelihood for almost 25 million people, because it's a constant river where people do farm of rice, sorghum, millet, and other form of farm produce. Also, it's the same source of livelihood for rearing animals, more especially nomad people, pastoralists that are moving from one place to another with their cattle for them to use the available grass there. Then this is the Lake Chad. But as a result of global warming, we all know the effect of global warming, that Lake Chad keep on drying, the amount of water that is flowing keep on reducing. And at the end, almost 70% of that Lake Chad is dry off as I'm talking to you now. This, as a result of this global warming, it render more than 80% of those people that their source of livelihood is under the Lake Chad become useless in the society. What I mean by useless, they have nothing to do because of the dryness of the river. They don't earn any money. A millionaire just gradually wake up, become a poor man, because his source of livelihood, as I said, is solely depend on the Lake Chad basin. Because of the force of global warming on Lake Chad, it render people poor. A poor man is very fragile, is very weak, and is very aggressive. He can do anything to sustain his source of livelihood. The Boko Haram, they came with huge amount of money. They are just recruiting people. They just somebody that spent 2-3 weeks without having a 1,000 naira or $3, and you are giving him $15 to go and attack somewhere. He coupled with the situation he finds himself, he can easily be attracted to that kind of things. So as a result of that, a lot of lives and properties were lost. Health workers, especially nurses, medical officers, including expatriates, because I can vividly remember when the Boko Haram insurgency was at peak, about more than 20 doctors were killed by Boko Haram. There was a time Boko Haram were on attack. As they were moving, there is one doctor's quarters. The doctors just had the sound of gunshot. As they came out, they just face to face with those insurgents. They just killed them, almost 5 of them. Then another one, they will just go there and be killing health workers. In fact, health workers also become source of attack. Sometimes if you are a health worker, they will just kidnap you, take you to the bush, because they are having wounded members and they don't know how to manage them. So they are kidnapping health workers, where nurses also are being kidnapped, being killed. Sometimes they will just go to the hospital, where a health worker, if they see you, they want to take you, and maybe you say you don't want to follow them, they end up shooting you. So they kill many health workers. At a certain time, we become in a certain situation whereby you don't trust anybody. Thank God the government at that time said health workers should stop wearing uniform. Even with personnel, they would just come and spy within the hospital. The moment they see you, even wearing personnel, you are moving from one ward to another, they just identify you as health workers and maybe attack you or kidnap you. So the advent of Public Service International, they came and trained and retrained us and taught us how to differentiate even the rights and privileges of health workers, and also the rights and privileges of IDP and refugee in general, whereby they make us to be partner in progress, giving us a capacity building, making us an agent of advocacy to the government, to the other non-governmental organizations and public opinion leaders together with the rich people in the society, so that we can bring assistance to the IDPs, we have been seeing a massive progressive changes where when we talk to the government used to give us listening ears.
To say a word or two.
From the federal government data, the 2022 flood displaced over 1.4 million people and killed over 603 people and injured more than 2,400 persons. About 82,000 houses were washed away and more than 333,000 hectares of land were washed away also. Most of the victims were concentrated on IDP camps and others were living in host communities. Public service workers and health workers were not spared from the flood, but they were still working. As a result of the flood, the overload of health workers drastically increased. Hospitals, primary health care centers, and schools were affected by the flood. The role of health workers in the IDP camps is enormous because they have the highest responsibility. Health workers provide essential medical care for individuals who may be injured or suffering from one disease or the other, ranging from chronic or acute diseases. Displacement can cause significant psychological stress. Health workers may offer counseling, mental health services to help individuals cope with trauma and stress. They keep track of health status of camp residents, identify potential health threats, and report outbreak of diseases to relevant authorities. They educate camp residents about hygiene, sanitation, and risks of outbreak in crowded camp conditions. Health workers often administer vaccines to prevent the spread of communicable diseases within the camp. They often work alongside humanitarian organizations and local authorities. Health workers collate data on health trends and the need on the displaced population, which help in planning resource allocations. Cases that are more than them in the camp that request special attention or surgery are being referred to nearby healthcare facilities. They assess the nutritional status and provide nutritional support and educate on proper nutrition. The health workers also conduct health education sections to promote awareness about disease prevention and healthy living. The health workers ensure the well-being of pregnant women, infants, children as a priority. Healthcare workers provide prenatal care and assist with the delivery and offer pediatric care to children who need special care and also children who are born in the IDPs.
I would like to tell the world that global warming is a natural or is a factual phenomena. Let us all put our hands on deck and make a lot of advocacy, enlightenment, create awareness to the public so that we can all solve this problem.